Lucky I didn't sue him. Go ahead. Thank you, Mr. Speaker. Mr. Speaker, honorable members, special invitees, members of the media, good afternoon to you all. And I think I also want to especially congratulate the two new SMPs here, Honorable Member Suraj Singh and Ms. Nandrani Kunja to the Assembly. Just let you know that I am a member of the opposition and my duty is to oppose. It's a budget debate, expose, and when necessary, depose. Mr. Speaker, let's start with the facts. Budget 2025 is here. It's big, bold, and once again, a big, bold disappointment for the hardworking people of Guyana. Yes, we do acknowledge the Finance Ministry staff for their dedication in putting together Budget 2025. But no amount of hard work can mask the cold, hard truth. This budget is a masterpiece of exclusion.
Mr. Speaker.
Designed for the elite, crafted for the well-connected, and funded by the sweat of struggling Guyanese families. A budget for the few and not the many. Mr. Speaker, I join with my colleagues to examine the budget presentation made by Senior Minister in the Office of the President with responsibility for finance and public service, Honorable Member, Mr. Ashley Kumar Singh, which was delivered on January 17, 2025, under the caption, A Secured, Prosperous, and Sustainable Guyana. Mr. Speaker, Budget 2025 stands at $1.382 trillion, 20.6% larger than Budget 2024. Regrettably, falls short, severely short, of the reasonable expectations of most Guyanese. It was an event that did not engage them. This budget is supposed to secure prosperity for all. Instead, it has secured more privileges for the privileged, more riches for the rich, and more burdens for the already burdened. While the government sings its favorite tune of economic growth, the average Guyanese sees nothing in their cupboards, nothing in their wallets, and nothing in their future. The only people who are truly prospering are the minister's F club, friends, family, and favorites. Mr. Speaker, let us be real. Prosperity is not measured by gross domestic product, GDP, figures in an air-conditioned offices, in air-conditioned offices. Prosperity is when a mother does not have to choose between buying food and paying school fees. Prosperity is when young graduates can find jobs without knowing someone. Prosperity is when hard work, not political connections, determine success. The struggle is real, Mr. Speaker. Guyanese are not just struggling, they are suffocating under the weight of a broken economy. Employment. The government brags about job creation, but the real question is, who are the people getting jobs, these jobs? Inflation. There is a reduction in discretionary expenditures and inflation, which was observed in paragraph 337. It indicates that 12-month inflation rate at the end of 2024 was estimated to be 2.9% because of, or rather was driven by food prices which had risen by 5.6%. Mr. Speaker, I will repeat that food prices have jumped, yet the government claims things are stable. Stable for whom? Poverty. Nearly half of our population, 43.4%, lives on less than US $5.50 per day. That is not building a secure Guyana. Rather, that is building a survival economy where families live paycheck to paycheck, hoping that the next check comes in time. And when people cannot afford basic necessities, the society crumbles. You would recall that in 2020, Guyanese murder rate was the fourth highest in South America and the sixth highest in the Caribbean. And in 2023, the homicide rate for Guyana was 19.7 per 100,000. That's balanced in South America. Hence, Mr. Speaker, when there is poverty, there is not only the possibility and potential for an increase in serious crimes, but there will be more domestic violence and certainly more desperation. In other words, Mr. Speaker, wealth inequality can be a precursor to societal ills. Mr. Speaker, how does a country that boasts of being the fastest growing economy leave its people starving for opportunities? There is little or no quantitative or qualitative change seen in the lives of the ordinary Guyanese citizens. Even the so-called middle class has not enjoyed a livable wage and income in this land of many resources. This budget, Mr. Speaker, gives no real answers, just empty slogans, empty platitudes, and recycled promises. Hence, in other words, I should say in the words of the African chant, a luta continua. The struggle continues, Mr. Speaker. Mr. Speaker, should I remind the Honorable Minister with responsibility for finance that real meaning must be given to Article 40, subsection 1 of the Guyanese Constitution, which speaks to the right of every citizen of Guyana to be happy, creative, and to live a productive life, free from hunger, ignorance, and want. But here we are, hungering, struggling, and with no clear vision for relief. Instead of addressing these issues with urgency, the government remains focused on optics and not on outcomes. Mr. Speaker, good planning is essential to securing sustainable economic prosperity. Budget 2025 demonstrates ineffective governance and poor planning. Mr. Speaker, there is governance and there is good governance. The Guyanese people are interested in good governance and considers the 8 principles set out by the United Nations. We on this side of the divide, the side with the people of Guyana, would want good governance. That is transparent, not tricky, accountable, not absent, proactive, not performative, and competent, not crooked. So, what do we have in our hands? A government that excels in excuses and underperforms in execution. A government that believes in a few cash grants here, a few cash grants there, everywhere a cash grant. Though maybe good in itself, but the government is convinced that cash grant can substitute for sustainable economic policies. Mr. Speaker, allow me to set the record straight on the condition of the health sector under the coalition. The people of our country will not be deceived by empty platitudes as they live their lives. They already know the difficulties they face in accessing health care services that were available before the PPP government squander the gains. The misleading claims indicated in the budget speech are intended to put our people into a false slumber, only to awaken sooner than later to the additional financial burdens with which they will be saddled. Of additional concern are the unfactual and derogatory remarks that preface the minister's other statements on healthcare. And I cannot let them remain unchanged. It is therefore necessary for me to contrast the condition of the healthcare system under the coalition with that of this present government. The minister's introductory remarks suggested that the health sector under the coalition was dwindling its thumb, where the nation's health was concerned. Implicit in his remarks, too, was the notion that the country has made strides in the health sector under the administration of the PPP. Nothing could be further from the truth, as the evidence that I will present reveals. The vital statistics accompanying this budget presentation contains a series of metrics on health. At this juncture, I wish to address two of them, because they are central to the provision of inpatient care and are very often factors in the survival of patients. The first metric refers to the number of hospital beds in Guyana, and the second refers to the number of nurses serving the people of this country. We use the number of hospital beds in the country to determine the strength of the healthcare delivery. This is a global measure to determine the extent to which a country cares for the sick citizens. I want Guyanese to know that the country had an average of 42 beds per 10,000 population during the period 2000 to 2002. I want to point out that there was a further decline from 2004 to 2014. In 2004, the number of hospital beds dramatically declined to 25 per 10,000 Guyanese. That was the reality that the coalition inherited in 2015 when it took office. Currently, it stands at 36 beds per 10,000. Now you are in the driving seat and you have to own it, what is happening. You have to own what's happening. Hence, after spending nearly 400 billion Guyana dollars on the health sector, this government could not bring this country to a better place than it was 30 years ago. This is clearly not a government for the future. Human resources. Mr. Speaker, the administration has allowed a good proportion of our health professionals to leave the healthcare system. The evidence is right under our nose in the appendix to the minister's presentation. From 2016 to 2019, there was an average of 5 nurses for 10,000 Guyanese. The coalition was working to build a reliable healthcare system and one that recognized the commitment and sacrifice coming from our healthcare workers. The spiteful and reckless conduct of this government, with its refusal to pay nurses a decent wage and to honor them for their sacrifice and commitment to this country, has now left every citizen depending on fewer nurses for care, and the remaining nurses seeking second jobs. It is not surprising, yet it's worrisome, because the data shows that we now have 23 nurses for every 10,000. These are the facts that the government hides from the Guyanese people and public so that they cannot recognize and understand the risk that is involved in their medical care. Without enough nurses, no amount of cash grants will bring you to the care that you and your family need. Those Guyanese who heard what the minister had to say on the measures to be taken if a nursing professional needed to seek a second job, even the unschooled would know that if the nurses were adequately remunerated in the first place, there would not be any need to look for a second job or to seek out greener pastures. There is one other point that I wish to the people of Guyana to know, and that is the healthcare system is in a state of crisis. In recent times, people who have sustained injuries that may not have been life-threatening would have succumbed to their injuries. I want to state it is a consequence of the decline in the availability of healthcare assets and providers that there is the experience or this experience and occurs. However, given the track record of this government, one is left to wonder about the correlation. Universal access to healthcare. Mr. Speaker, it's not a secret that primary health care must be the pillar of the nation's health strategy and should take center stage if universal health coverage is to be achieved. The national public health system has an obligation to deliver public health services to the citizens of Guyana, regardless of whether they reside on the coastland or hinterland, according to Mr. Granger in his book, Public Health is a Public Good, Risk and Responses in Small States. The author went on to note that everyone should receive the health services needed without incurring financial distress. In other words, Mr. Speaker, universal access cannot mean turning up at a public tertiary institution for a service which is expected to be rendered, only to be told, look some money or a voucher, please go to a popular private institution to access the needed screening assessment and analysis needed, that you need. Facilities. Mr. Speaker, at paragraph 4.108, reference is made to a plethora of health facilities such as specialty, pediatric, and maternity hospital at Ogle, the new hospital at New Amsterdam, and at regional hospitals and health centers, works which continue to be ongoing but not yet completed. We on this side of the divide pay strict attention to the training complexes which are to be built in Surrey and New Amsterdam, in addition to the 2 dormitories for health sciences training, to the tune of 852 million. We stress that there must be value for money. We also wish to sound the alarm that the health facilities and living quarters which are to be upgraded and retrofitted be built under the standard building code and with the correct specifications to avoid any undue calamity or catastrophe to the hard-working health professionals of our country. Equipment. Paragraph 4.110 speaks to expanding equipment pool, thus accommodating laparoscopic surgery, laparoscopic kidney transplant, bariatric, and minimal invasive surgeries. We will continue to sound the battle cry that there must be adequate and skilled biometric technicians for the maintenance of such equipment. Mention is also made of equipment at the telemedicine sites at regions 1, 4, 5, 8, and 9. With allocation of $4.3 billion to the purchase of medical equipment in the health field, it is expected that there will be quality assurance, better diagnosis, leading to better treatment and monitoring of the patients. There seems to be no intentional move to procure mammogram machines and have equipment available to carry out tests for prostatic-specific antigen so that patients can have access to the best care. As you know, breast cancer is a top-ranking cancer among the females, whereas the prostate cancer ranks first among the males in Guyana. Mr. Speaker, as we run equipment, I should be optimistic because of the services rendered at the Diamond Hospital. But patients have fallen off wheelchairs. Observation revealed that there were no rubbers on the wheels of that important equipment. How is that possible in an oil-rich economy? And Mr. Speaker, where is the porters? At that institution, I think the Sunday, no porters. People want jobs. According to Primary Healthcare Performance Initiative, 2022, a strong primary care is dependent on affordable, timely, and dependable access to safe, effective, and high-quality medicines and supply. Mr. Speaker, the government is proudly allocating $28.1 billion for drugs and medical supplies. Yet the Auditor General's report tells a damning story. Billions paid upfront to contractors, yet nearly $1 billion worth of drugs and supplies remain undelivered. Let me put it bluntly. Sick people cannot swallow press releases. Hospitals cannot treat patients with missing medicines. This is not just inefficiency, it is reckless mismanagement. The Honorable Minister must immediately implement an electronic logistic management information system, the ELMIS, to track the stock, the usage of the drugs and in the losses. No more expired drugs, no more empty shelves, no more excuses. If this government had the political will, it would have done this already. Chronic diseases. Screening for a chronic disease can allow for a gain in lead time by early diagnosis, as there is the identification of risk factors before the health practitioner, and guess he can distinguish clinical, help him in this, to distinguish the clinical semiology, the signs and symptoms. Mr. Speaker, we are talking about chronic disease, non-communicable diseases, and we're talking about diseases like heart disease, ischemic heart disease, diabetes, and of course the silent killer, hypertension. In Guyana, they are thriving. Why? Because prevention is an afterthought. The Hearts protocol expansion is a step in the right direction. But what about the hinterland regions? What about communities where doctors are scarce and screenings are non-existent? The government's approach to healthcare is like patching potholes while ignoring the crumbling road beneath. We need nationwide screenings, early intervention programs, and community-based health workers. Let's stop treating symptoms and start preventing diseases. Mental health. Mental health is more than just a photo op. Mr. Speaker, mental health is the orphan of our health system. There is no health without mental health. Yet it's underfunded, ignored, and dismissed. The conversion of the New Amsterdam Hospital into a mental health facility sounds impressive, until you realize there is no comprehensive plan, no feasibility study, and no real investment in long-term mental health care. The government is obsessed with buildings over brains. A few extra hospital beds will not fix the mental health crisis. We need trained professionals, community-based mental health services, and nationwide suicide prevention programs. If the government is serious, let's see the data, the indicators, and the measurable targets. Otherwise, this is just another election year gimmick. Communicable diseases. Are we prepared or just hoping? Mr. Speaker, of course, the minister spoke about the different diseases and communicable diseases which we want to eliminate. Of course, that's commendable. We all want to get rid of lymphatic filariasis, leprosy or Hansen's disease, malaria, hepatitis C, the vertical transmission of HIV, and of course some vaccine-preventable disease. But Mr. Speaker, Guyana is facing a dengue crisis. 10,000 cases, 11 deaths, I think within up to September. And yet we are still scrambling in 2024. Where is the vector control strategy? Where are the mosquito nets for at-risk communities? Where is the aggressive fogging campaign machines, especially in regions 1, 2, 4, and 6? Climate change is fueling disease outbreaks, yet this government is always playing catch-up. Mr. Speaker, hope is not a public health strategy. This government must act now, not after another outbreak sweeps through our communities. Maternal child health and adolescent health, it's a national embarrassment. Mr. Speaker, too many Guyanese mothers are dying in childbirth. Too many newborns are not making it past their first breath. Recently, we saw 2 tragic maternal deaths, one at the Georgetown Hospital, one at New Amsterdam Hospital. Families are mourning, and the government is silent. Within 48 hours, a mother complains of negligence and malpractice to the CEO of the Georgetown Public Hospital. Valiant efforts must be made to monitor both mother and baby to enjoy safe delivery and optimal health in the light of the declining nursing staff and adequate supervision. We already know the delays that can form barriers to proper maternal health care. So, Mr. Speaker, I'm imploring the health minister and the team to do something about this frequent occurrence, which brings discomfort and death to our citizens of Guyana, who access the maternal health services throughout the 10 administrative regions, especially in Region 6, the East Berbice County region. Mr. Speaker, the measure of support for newborn babies with a one-off grant of 100,000 is noted, though there's a lack of context. And by the way, my colleagues, you have to be careful with your ideas, because I sent a question to the clerk, asking Minister, with all these maternal deaths and the cost of living, could we have a grant for mothers? And so there it goes. There it goes. So you have to be very careful. So you have to be very careful of giving out your ideas. And I know I see with the opposition leader when you have to, kind of gauge when to give your ideas out. Mr. Speaker, but it never reached the paper, it never reached the paper. Mr. Speaker, the measure of support for newborn babies with a one-off grant of 100,000 is noted. Though there's a lack of context, what should have been said is that because of the first 1,000 years of days in a child's life, where there can be a threat of malnutrition, be it over malnutrition or under malnutrition, but malnutrition, they have different stages. It could be mild, moderate, and severe malnutrition too. So I just want to get our record straight. The nutritional component of the child can be enhanced with this grant, which can assist in the growth and development in the child's physical, cognitive, and social development. But the question remains, as with the rising cost of living, one wonders if this sum is adequate. Where are the emergency response protocols? Where is the accountability for medical negligence? Okay, let me speak a little bit again on shortage of critical staff for health sector of Guyana. According to the Auditor General's report, when considering the performance of the maternal unit of the Georgetown Public Hospital Corporation, it was found that out of the proposed staff strength of 280, there was a shortage of 103 staff members. In addition, there has been also a shortage of 49 qualified midwives, 18 staff midwives short, 14 patient care advocates short, 10 ward managers short, 11 staff nurses short. In addition, for the delivery room, the nurse-to-patient ratio had been 1:3 rather than 1:1. In the labor ward, the nurse-to-patient ratio had been 1:8 rather than 1:3. And in the postnatal unit, the nurse-to-patient ratio had been 1:15 rather than 1:6. Where is the investment in maternal health training and rural obstetric care? A one-time 100,000 baby grant might buy diapers, but it won't buy a future if the child doesn't survive the first 1,000 days due to malnutrition and lack of postnatal care. Mr. Speaker, motherhood should not be a death sentence in Guyana. A government without vision cannot lead. Mr. Speaker, a country's budget is more than just numbers. It is a statement of priorities. A budget that fails to create real jobs fails the people. A budget that keeps people hungry fails the people. A budget that neglects health care fails the people. And this budget, it's a spectacular failure. Mr. Speaker, let me share our new vision for Guyana. Mr. Speaker, our vision is clear. When we take office, we will make economic growth work for the people, not just the privileged few. Turn jobs into careers so people can build a future, not just survive. Fix the healthcare system because good health should never be a luxury. This is not just politics. It is personal because when the people thrive, Guyana thrives. The people will decide. Mr. Speaker, the people are not fooled. They see the reality. They feel the struggle. And they know that this government has failed them. Budget 2025 was supposed to be about a secure, prosperous, and sustainable Guyana. Instead, it has delivered insecurity for the working class, prosperity for the privileged few, sustainability for those already at the top. But the good news, this is temporary. Because in the next election, the people will choose a government that fights for them. And when that day comes, we will deliver not just promises, but results. Mr. Speaker, this budget is being sold as a step forward, but the reality is clear. It is an expensive band-aid on a health system in crisis. While the government touts its spending increases, The average Guyanese citizen is left behind. Where is the impact? Where is the accountability? Where is the vision for a modern, functional healthcare system that truly serves the people? As I summarize, Budget 2025, a high-priced illusion. The government boasts that 143.2 billion is being poured into the health sector. But let me ask the people of Guyana, does your hospital have enough doctors? Do you wait hours, sometimes days, for basic treatment? Can you afford your prescription medications? This is not just about numbers, Mr. Speaker. It's about the citizens' lives. And under this administration, the health system is failing the people who need it most. So, the PNC-APNU vision is for real change and real solutions. Under the APNU-AFC government, we will build a truly modern healthcare system, not just expensive structures with empty promises. Our plan includes a national health policy focused on real public needs, not political optics, a strong primary healthcare system that prioritizes prevention and early intervention, universal access to affordable medications with transparent procurement and distribution, let's say practices, expanded maternal and child health care, ensuring no mother dies needlessly in childbirth, a real mental health strategy with community-based care, not just hospital beds, preparedness for health emergencies, so outbreaks like dengue don't catch us off guard. These are some of our points. We can't give you all, lest you want to copy them. As I conclude, Mr. Speaker. Mr. Speaker, let me thank the Finance Minister for presenting what I would call is government's exit budget. It's an exit budget. This budget is a desperate attempt to buy goodwill before an election. But the people of Guyana are not fools, as I said before. They see the waste, the mismanagement, and the lack of real progress. To the Guyanese people, my good friends, comrades, I say this: you deserve better. You deserve a government that puts your health, your future, and your well-being first. This budget does not deliver that future, and that is why we cannot and will not support it in its current form. Thank you, Mr. Speaker.
Thank you very much, Honorable Member Dr. Cummings. And now for our Honorable Minister of Health, the Honorable Dr. Frank Anthony.
Thank you very much, Mr. Speaker, honorable members. First of all, I want to thank Dr. Ashley Singh and his staff for another excellent budget, guaranteeing everyone in Guyana will benefit from this budget. Whether you're a child or an adult, whether you live in the hinterland or on the coastland, whether you work for